This is the femoral nerve. It arises from the lumbar plexus, from the second, third, and fourth roots, and runs a short course in the abdomen. It enters the thigh behind the inguinal ligament and ends shortly below it by giving off muscular and cutaneous branches. The muscular branches supply the four heads of the quadriceps femoris muscle, which are the rectus femoris and the three vasti. This is the nerve to the rectus femoris entering its upper part. It also supplies the sartorius and pectineus muscles. As regards its cutaneous branches, they are the intermediate and medial cutaneous nerves of the thigh and the saphenous nerve. The saphenous nerve runs lateral to the femoral artery and crosses over it from lateral to medial at the apex of the femoral triangle to enter the adductor canal with the femoral vessels. This is the femoral artery. It is the continuation of the external iliac artery. It enters the thigh at the mid-inguinal point, which is a point midway between the anterior superior iliac spine and the symphysis pubis. The course in the femoral triangle is superficial, but its course in the adductor canal is deep to the sartorius muscle. As it runs in the femoral triangle, it gives off most of its branches. This is the profunda femoris. It arises about 4 centimeters below the inguinal ligament from the posterolateral aspect of the femoral artery. It runs medially deep to the femoral artery in the hollow of the femoral triangle. It runs over the pectineus and adductor brevis muscles, where it gives off its first, second, and third perforating arteries. This is the first perforating artery. This is the second perforating. This is the third perforating. This is the termination of the profunda, which is the fourth perforating artery. They are called the perforating branches because they pierce the adductor magnus to reach the back of the thigh. At its termination, the profunda femoris artery is deep to the insertion of the adductor longus muscle. This muscle intervenes between the femoral vessels in front of it and the profunda behind it. The other branches of the profunda artery arises close to its origin and may arise abnormally from the femoral artery. These are the lateral and medial circumflex arteries. This is the lateral circumflex artery. In this body, it arises directly from the femoral artery. It runs laterally among the branches of the femoral nerve, deep to the sartorius, where it divides into ascending, transverse, and descending branches. The ascending branch ascends towards the anterior superior iliac spine. The transverse branch runs laterally through the vastus lateralis and runs round the femur to reach the back of the thigh to join the cruciate anastomosis. The descending branch descends along with the nerve to vastus lateralis to the knee joint to share in the anastomosis around the knee. This is the beginning of the profunda femoris artery. This is the medial circumflex femoral artery. It runs medially and backwards between the pectineus and obturator externus muscles, then continues to appear on the back of the thigh at the upper border of the adductor magnus, where it shares in the cruciate anastomosis. It gives a branch to the hip joint and will be discussed later in the gluteal region. This is the femoral artery passing through the adductor canal. This canal is triangular in cross-section. It is bounded laterally by the vastus medialis. Here, the nerve to vastus medialis is seen sinking into its substance. Posteriorly lie the adductor longus muscle, as well as the adductor magnus. The roof of the canal is formed by thick, deep fascia and the sartorius. The contents of the canal are the femoral artery, the femoral vein, and the saphenous nerve, together with the nerve to vastus medialis. The femoral artery leaves the canal through the opening in the adductor magnus to reach the popliteal fossa and becomes the popliteal artery. Just before it leaves the canal, it gives off its descending genicular branch, which descends to the knee joint to share in the anastomosis around the knee. The saphenous nerve leaves the canal under the sartorius muscle between it and the gracilis, and from now on till the foot it becomes superficial. This is the right lower limb to show the course of the saphenous nerve in the leg. This is the saphenous nerve as it emerges from under cover of the sartorius muscle. Here it gives off its infrapatellar branch and which curves forwards and downwards to share in the plexus of nerves around the patella. The saphenous nerve continues downwards in the superficial fascia of the medial side of the knee and leg, and then in front of the medial malleolus in company with the great saphenous vein. It continues thereafter on the medial side of the foot towards the big toe.